Every 66 seconds, someone in this country is told they have dementia. By the time you finish watching this video, nearly 20 more families will hear those words. But here's the part no one talks about. For many of them, it wasn't just aging. It was a pill. A pill sitting quietly in their medicine cabinet. A pill they were told was safe. I'm Dr. William. After 15 years in practice, I've seen this story repeat itself over and over. A sharp, independent person slowly begins to forget things. Names slip, appointments vanish. Even familiar roads feel confusing. And everyone says the same thing. It's just getting older. But sometimes, it's not. Today I'm going to walk you through 9 medications strongly linked to memory loss, starting from the most overlooked to the most dangerous. Number 3 is one millions of seniors take every day without a second thought. Let's begin. Diphenhydramine, better known as Benadryl. It's that common allergy or sleep pill many people use nightly. Seems harmless, right? Not exactly. It's an anticholinergic, which blocks acetylcholine, a key brain chemical responsible for memory and focus. As we age, we already have less of it. Blocking it further can directly impact the hippocampus, the part of your brain that forms memories. Studies show regular use is linked to a 54% higher risk of dementia. Proton pump inhibitors, like omeprazole and esomeprazole. These are widely used for acid reflux, but long-term use reduces vitamin B12, magnesium, and calcium, nutrients your brain needs to function. Low levels can mimic early Alzheimer's symptoms. Research found a 44% increased dementia risk in long-term users. Oxybutynin, used for overactive bladder. It works, but at a cost. It also blocks acetylcholine and easily enters the brain. Long-term use has been linked to a 49% higher dementia risk. Safer alternatives exist, but many patients are never told. Statins, like atorvastatin and simvastatin. These are essential for heart health, but some types cross into the brain and may affect memory, especially at higher doses. Not all statins are equal, and adjustments can often solve the issue. Benzodiazepines, like Xanax, Valium, and Ativan. Used for anxiety and sleep, they calm the brain, but also slow it down. Long-term use is associated with a 51% increased risk of Alzheimer's. Stopping suddenly can be dangerous, so these must be tapered carefully. Amitriptyline, an older antidepressant still used for pain and sleep. It strongly blocks acetylcholine, and long-term use has been linked to a 54% increased dementia risk. Script 12, paroxetine, also known as Paxil. This one surprises many people. It's an SSRI antidepressant, but unlike others it has strong anticholinergic effects. Studies show noticeable declines in memory and attention within just 1 year. Safer alternatives like sertraline exist. Antipsychotics, like Seroquel or Risperdal, often given to seniors for sleep or agitation, even without serious psychiatric illness. They suppress dopamine, slowing thinking and increasing risks of stroke and rapid cognitive decline, up to 71% higher in some studies. And finally, the number 1 hidden danger, anticholinergic polypharmacy. It's not just one drug, it's the combination of several. A sleep aid, a bladder pill, maybe something for pain, all quietly blocking the same brain chemical at once. Individually, they seem harmless. Together, they can double the risk of dementia. Here's the hopeful part. In many cases, this kind of memory loss is reversible. When the right medications are reduced or replaced, people often regain clarity within weeks. So here's what you should do. Schedule a full medication review. Go over every prescription, every over-the-counter pill, every supplement. Because sometimes protecting your brain isn't about adding more. It's about removing what's quietly harming it. How many medications are you taking right now? If this opened your eyes, check what's really behind the symptoms we so often call aging. Your brain deserves better.